कवर कर रहे थे विजन आईएएस का 2023 का करंट अफेयर। ये इन्वायरमेंट साइंस एंड टेक्नोलॉजी में आई थिंक नहीं साइंस एंड टेक्नोलॉजी में ही है। So 3 parent baby recently a baby has been born using the 3 people's DNA in the UK with the help of the mitochondrial donation treatment procedure. The mitochondrial donation treatment MDT technique in which the child is conceived from the IVF in vitro fertilization using the genetic material of the parents and the mitochondria and material of the donor. Genetic material of the parent, mitochondrial material of the donor. Mitochondria basically the powerhouse of the cell. They generate the energy and thus it is responsible for the cell function in the human body. Certain defects it occur impacting on the way the mitochondria produce energy for the cells and thereby impact the cell function. The disease that arise out of such mitochondrial mutations are called mitochondrial disease. When the mitochondria are impaired and they do not produce sufficient energy that affects all the organ function, leading to the broad assessment of symptoms across the body, including a brain damage, organ failure, and muscle wastage. Unlike the nuclear DNA which come from both the parent, mitochondrial DNA comes only from the mother. Mitochondrial donation. Unlike nuclear DNA which come from both the parent, mitochondrial DNA comes only from the mother. MBT is a technique when the child is conceived from the IVF in vitro fertilization using the genetic material of the parent and the mitochondrial material of the donor. It works on the principle in which the diseased mitochondria are replaced by the healthy mitochondria in order to avoid the transfer of the mitochondrial disease from the mother to the offspring. Passing to the mitochondrial disease from the parent to the child can be prevented by mitochondrial donation treatment either before or after the IVF of IVF. It is also known as mitochondrial replacement MBD and 3 parent babies process due to the involvement of the 3% mitochondrial inheritance in a family. This is the grandmother with a faulty mutated mitochondrial gene. ओके इन दोनों के फ्यूजन से ये अफेक्टेड सन है, अफेक्टेड डॉटर है। ओके अगर हम इनको नॉन अफेक्टेड से इनका वो कराएंगे नॉन अफेक्टेड से तो वो मैंने तो पक्का बच्चा अफेक्टेड होगा। ठीक है, अनअफेक्टेड सन अनअफेक्टेड डॉटर डोनर आगे ये हो सकता है। तो अनअफेक्टेड डॉटर अफेक्टेड ये एक वाला ये नॉर्मल माइटोकॉन्ड्रिया है। ठीक है, ये अनअफेक्टेड डॉटर जो है वो अनअफेक्टेड है और ये फॉल्टी माइटोकॉन्ड्रिया। ओके माइटोकॉन्ड्रिया रिप्लेसमेंट थेरेपी एंड 3 parent babies जैसे embryo combine sperms and egg from the biological parents with tiny battery like structure called mitochondria from the donor's egg. Resulting baby has DNA from the mother in the form as usual plus a small amount of genetic material about 37 genes from the donor. 37 genes from the mother. Mitochondrial donation treatment. This is the mother fertilizer unhealthy mitochondria nucleus. This is donor fertilizer healthy mitochondria donor her egg. ठीक है, donors fertilizer egg. This is parents nuclear material removed. Parents nuclear material removed and kept. Donor nuclear material removed. Parents nuclear material and destroyed. Removed parents nuclear material and destroyed. Parents nuclear material placed inside donor का egg. जो donor के egg के अंदर parents का nuclear material डाल देंगे। नीचे तो there are 2 common technique MST and PNT. In both the technique, eggs or embryos are created using the nuclear genetic material and healthy donated mitochondria. In both MST, maternal spindle transfer technique and PNT, the resulting embryos would contain the parent genetic material. Both techniques work equally well. Nuclear genetic material is removed from the eggs. Nuclear genetic material is removed from the eggs and transferred into the donated egg, which have had their nuclear genetic material removed. The eggs are then fertilized. Nuclear genetic material removed from the eggs and transferred into the donated egg, which have had their genetic material. The eggs are then fertilized with the sperm to create embryo. Maternal spindle transfer technique. Donor का egg लिया हमने, ये healthy mitochondria, one healthy donor's nuclear DNA is removed. As a result, 2 mothers nuclear DNA removed from her. 2 mother का nuclear DNA is removed from her egg and inserted into the donor egg. ठीक है, removed. This is inserted. ये remove कर दिया. Now this is inserted into the donor's egg. Okay, वहाँ से लिया और sperm से भर लिया. As a result, the donor egg is left with nuclear DNA from the mother and DNA from the donor. Nuclear DNA from the mother and DNA from the donor. Now this is sperm. Healthy egg is then fertilized with the partner sperm and implanted into the mother's womb. Okay, this is maternal spindle technique transfer. Pro-nuclear transfer technique MST. Eggs are fertilized with a sperm in a lab. जो eggs होते हैं they are fertilized with a sperm in a lab to create embryo. The nuclear genetic material within each embryo is then transferred into the embryos created using the donated egg and sperm from the sperm provider. Again, the genetic material have been removed from the donated egg. This is donor. This is the patient couple. Pro-nuclear transfer technique similar to ministry. This is mitochondrial spindle transfer. Maternal spindle transfer. Pro-nuclear transfer technique. Donor healthy mitochondria. First is healthy donor's egg is fertilized and patient egg is fertilized. Mother's nuclear DNA removed from her egg. Mother का nuclear DNA abnormal mitochondria. Mother's nuclear DNA and inserted mother's nuclear DNA nuclear DNA removed from egg and inserted into the donor's egg. Healthy egg is fertilized with partner's sperm and implanted into the mother's womb. As a result, the donor egg is left with nuclear DNA from the mother and DNA from the donor. Healthy egg is fertilized. Okay, again, the benefits of the mitochondrial donation treatment disease. There are no effective treatments for mitochondrial disease that can cause severe health issues. MDT offers a chance for a healthier life of a baby. About 1 in 6,000 babies are affected by mitochondrial disorder genetic connection. MRT can assist the older women with poor quality eggs. Older and poor quality eggs to have a biologically related child by retaining the woman's nuclear DNA while using the mitochondria from a younger donor. Ethical concerns with MDT potential for design, as MDTs involve genetic modification and they could potentially open the door for the creation of the design of babies embryos genetically engineered for preference security. There being simple multitude of ethnic culture related to eugenics and the potential misuse of the technology. Eugenics refer to the selection of the desired heritable characteristic in order to improve the future generation. Eugenic selection of desired heritable characteristic to improve future generation, typically in reference to human. Issue of the mitochondrial donor's role in child's life. The donor plays a significant role in child's health conception. Issue of mitochondrial donor's role in child's life. The donors play a significant role in child's healthy conception. But issue of mitochondrial donor role in child, but their contribution is limited to the nature. This creates ambiguity with the donor's biological claim on the child or involvement in the live reproductive freedom. MRT can benefit the same-sex female couple. Same-sex female couple seeking a child genetically related to both, with the one woman providing nuclear DNA and the other providing mitochondrial DNA. Issues with mitochondrial donation treatment effectiveness. The dynamic nature of the mitochondria का nature बहुत ही dynamic है, and the potential residual damage mitochondria after the transfer could compromise MRT's effectiveness and long-term benefit. Potential incompatibility between donors mitochondria and the receiver's nuclear genome could pose challenges. Incompatibility risk. Lack of data. MRT is in the experimental stage with inadequate data on potential adverse effects, making careful application critical. Lack of data. Impact on children. There are concerns that MRT could influence the child's personality, including the potential neurological changes and post-natal development, disability, and increased cancer risk. Cause by the MRT is a costly procedure making management to many sections of the society. Costly है, impact on child, cancer वगैरह हो सकता है, development disability, lack of data, incompatibility risk हो सकता है, effectiveness considering is to be implemented in the country. There should be a regulatory body that governs its users to avoid any unethical practice. Proper clinical trials are needed of the app or data to be collected on the safety and efficacy of the technique being used. Antimicrobial resistance. Recently, WHO in partnership with the Global AMR and Research and Development Hub has released incentivizing the development of the new antibacterial treatment 2023 report. New antibacterial treatment 2023 report is for the G7 countries monitoring and handling of AMR. About the global AMR research and development hub, it is a global partnership of countries, non-governmental donor organization and the intergovernmental organization. It was launched in 2018. It is report is for the G7 countries who is monitoring the handling of the antimicrobial resistance. About antimicrobial research and development, which is a partnership of the countries, NGOs, donor organization, intergovernmental organization. It was launched in 2018. Total challenges improve coordination, collaboration, the global AMR research and development using One Health approach. World Health Organization was established in 1948. Its headquarters in Geneva, Switzerland. United Nations Agency is 194 member states to promote the health, keep the world safe, and serve the vulnerable, so everyone everywhere can attach the highest level to explain the universal health coverage, direct and coordinate the world's response to health emergencies, and promote the healthy life from pregnancy, care through old age. About the antimicrobial resistance, according to WHO, antimicrobial resistance occurs when the bacteria, virus, fungi, and parasites change over time and no longer respond to the medicine taking infection, harder to treat, and increasing the risk of the disease spread, severe illness, and death. As a result, the medicine becomes ineffective and infection persists in the body, increasing the risk of spread to others. Klebsiella pneumonia, which is resistant to both Klebsiella pneumonia, which is resistant to both Klebsiella pneumonia, which is resistant to both carbapenem and third generation cephalosporin. Facts about the antimicrobial resistance: 24 million people may be pushed into extreme poverty. Top 10 threat for the global health as per WHO. 24 million. Facts about the antimicrobial resistance: 24 million people may be pushed into extreme poverty. 24 million people may be pushed into extreme poverty. Top 10 threat for the global health as per WHO. Klebsiella pneumonia. Misuse and the overuse of antimicrobial, lack of enforcement of legislation, lack of access to clean water, sanitation and hygiene for both humans and the animal tribals of antimicrobial resistance, lack of awareness and knowledge, poor infection disease prevention and control in healthcare facilities and farm, poor access to quality affordable medicine, vaccines and diagnosis. Misuse and overuse of antimicrobial, lack of enforcement and legislation, lack of awareness and knowledge, lack of enforcement of legislation. ठीक है. लेजिस्लेशन को एनफोर्स नहीं कर रहे, मिस यूज एंड ओवर यूज ऑफ एंटी माइक्रोबियल, लैक ऑफ अवेयरनेस एंड नॉलेज, लैक ऑफ एनफोर्समेंट एंड लेजिस्लेशन, लैक ऑफ अवेयरनेस एंड नॉलेज, पुअर एक्सेस टू क्वालिटी अफोर्डेबल मेडिसिन, वैक्सीन एंड डायग्नोस्टिक, पुअर इन्फेक्शन एंड डिसीज प्रिवेंशन एंड कंट्रोल इन हेल्थ केयर फैसिलिटीज एंड फाउंड लैक ऑफ एक्सेस टू क्लीन वाटर सैनिटेशन फॉर बोथ ह्यूमंस for both humans and the health. Antimicrobial, a simple overview, prevent or treat infection caused by the bacteria such as antibiotics, also known as antibacterial such as cellulitis, urinary tract infection, tuberculosis, sexually transmitted infection like gonorrhea. Prevent or treat infection caused by bacteria such as cellulitis, urinary tract infection, tuberculosis. Prevent or treat infection caused by the virus such as the cold, flu, chickenpox, shingle, COVID-19 or HIV. Antivirals. Okay. Antimicrobial medicine used to prevent and treat the infection caused by the microorganism in humans, animals and plants. Antifungal, prevent or treat infection caused by fungus, just thrush, ringworm, at least food. Antiparasitics, prevent or treat infection caused by parasites such as malaria, threadworm and head lice. An antimicrobial drug can only one type of consequence of antimicrobial resistance: high medical cost because of higher cost of second-line drugs, prolonged hospital stays as available drug take more time to cure the disease, increased mortality. As per the Lancet report, EMR is a leading cause of death worldwide, and it's more 3,005 people every day. Ring of the major superbug refers to the germ that has formed resistant to multiple drugs. For example, methicillin resistant staphylococcus aureus. Economic cause in the next decade, AMR could result in a GDP shortfall of at least USD 3.4 trillion annually. India topped the list of the countries and with the highest antibiotic consumption and highest antimicrobial resistance. Also, the Lancet paper rated 5 pathogens for defeating some of the most effective antibiotics in the country: Staphylococcus aureus, Mycobacterium tuberculosis, Escherichia coli, Acinetobacter baumannii, and Klebsiella pneumonia. As per the 5th detailed report on antimicrobial resistance by the ICMR, resistance level is increasing to 5 to 10% every year for broad spectrum antimicrobials which are highly misused. Key anecdotal report among the top 10 global public health threat facing humanity, AMR is associated with the death of 4.95 approx 5 million people in 2019, which is more than HIV or malaria. HIV और मलेरिया से नहीं मर रहे, MER से ज़्यादा मर रहे हैं. Threat to the global economy, impact international trade होता है, health care cost and etc. could cost the world economy USD. इतने लोग अप्रॉक्स 5 मिलियन लोग मर रहे हैं. अप्रॉक्सीमेट जो कॉस्ट आ रहा है हेल्थ पे वो 100 ट्रिलियन बाय 2023 हो जाएगा. Insufficient development for new antibiotics is insufficient. Antibacterial is insufficient to tackle the challenge of increasing emergence and spread of antibiotic resistance. Poor return for developing new antibiotics. There is no viable market for novel antibiotics. That is why new reserves antibiotics fail to cover the cost of the development, manufacturing and distribution. Other factors leading to AMR triple planetary crisis. It refers to the three main interlinked issues that humanity currently faces: climate change, pollution and biodiversity. Other factors leading to AMR is climate change, pollution, biodiversity loss. Climate change and AMR. A warmer global climate may lead to more widespread resistance as higher temperature increase the rate at which genes are transferred from microbe to microbe. In addition, the extreme weather due to climate change can trigger the failure of the very such as the seawars between humans and the marine and microorganism. Biodiversity loss and AMR. The loss of the biodiversity even in the microbial level can as well develop AMR among micro pollution and AMR. Effluent from the pharmaceutical industry, hospitals, human waste, agriculture expose germ to the drug, giving them more chance to evolve resistance to them. The pollutants such as the heavy metal like zinc can also prime the development of resistance to important antimicrobial. Global step to handle the antimicrobial resistance. Global action plan on antimicrobial resistance. Global action plan on antimicrobial resistant technology. It aims to ensure the continuity of successful treatment and the prevention of the infectious disease with effective and safe medicine. Aware access, watch and reserve tool. It was developed by the WHO Essential Medicine List to contain rising evidence and make antibiotic use safer and more effective. Use antibiotic use safer and more effective. Aware access, watch and reserve tool. Global Action Plan on Antimicrobial. Global Action Plan on Antimicrobial GAPA WHO. It aims to ensure continuity, successful treatment and prevention of the infectious disease with effective and safe medicine. Aware access, watch and reserve tool is developed by the WHO Essential Medicine List to contain rising resistance and make the antibiotic use safer and more effective. Global Antimicrobial Resistance and Use Surveillance System. Global Antimicrobial Resistance and Use Surveillance System WHO. Global Action Plan on Antimicrobial Resistance. Global Antimicrobial Resistance and use of surveillance system 2015 to foster AMR surveillance and inform strategies to contain AMR. National Action Plan on Containment of Antimicrobial Resistance. National Action Plan on Containment of Antimicrobial Resistance was launched in 2017, focused on an integrated One Health approach, involves coordination among the various sectors at the state. देखो One Health approach होना चाहिए, coordination होना चाहिए, Delhi Declaration on AMR. It is an interministerial consensus was signed by the ministers or the concerned ministers, pledging their wholehearted support in AMR treatment. AMR research international collaboration. ICMR has taken initiative to develop new drugs and medicine through international cooperation in order to strengthen medical research in AMR. A warmer global climate may also lead to more widespread resistance, as higher temperature can result the rate of the way genes are transferred from micro to recent extreme weather due to climate change can trigger the failure of the virus such as fever between humans and violent microorganisms. Biodiversity loss in AMR. The loss of the biodiversity within the microbial can and as well develop AMR among the micro pollution in AMR. Effluent from the pharmaceutical industry, hospital, human waste, agriculture expose them to the drug, giving them more chance to evolve resistance to them. The pollutants such as heavy metals like zinc and also prime the development of resistance to important antimicrobial code, and the pandemic has accelerated AMR because of the widespread consumption of antibiotics during the various waves. Antibiotic used in animals reared for human use. Eating animal meat is similar to ingestion of tablets, which ultimately lead to AMR. Eating animal meat is similar to ingestion of tablets, which ultimately antibiotic used in animals reared for human use. COVID-19 pandemic is because of widespread consumption of antibiotics. Pollution and AMR. Effluent from the pharmaceutical industry, hospital, जो भी effluent निकलते हैं pharmaceutical industry, hospital, human waste, and agriculture exposes them to the drug, giving them more chances to evolve resistant to them. The pollutants such as heavy metals like zinc can also prime the development of resistance to important antimicrobial. Banned 40 fixed dose combination which were found in inappropriate antibiotic stewardship. Antibiotic stewardship program to control misuse and overuse of antibiotics in hospital wards and ICU. Regulation. It is independent because assigned by the ministers of the concerned ministry, pledging their whole support in AMR containment. National Action Plan containment antibiotic. Okay. Suggestion to handle AMR. Enhance environmental governance. Environment को governance करो, planning proper करो, and regulatory framework. Specific actions should include developing legislation, codes of good practice, policy guidance to support action to minimize environmental release of AMR relevant pollutant. Example: Sweden appointed the world's first AMR ambassador. Who appointed the world's first AMR antibiotic research ambassador? Sweden. Transparency and accountability. To have the system that allows the consumer to hold the producers accountable for prudent antimicrobial use. Allows to have system that allows the consumers to hold producers accountable for prudent antimicrobial use. Transparency and accountable system. To have system that allows the consumer to hold producers accountable for prudent antimicrobial use. Transparency, accountability, enhance environmental governance, planning, regulatory, identify and target priority AMR, relevant pollutant reduce release of chemicals and chemical pollutant and biological pollutant affecting the environment and address the origin, improve reporting, surveillance and monitoring as part of the plan to mitigate the discharge of antimicrobial into the environment essential to impact the necessary to measure the impact of the antimicrobial pollution and biodiversity, integrate environment monitoring data, prioritize financing innovation capture, need to introduce innovative and sustainable financing to address the AMR, such as elimination of the restorative subsidies in agriculture. Such as elimination of restoring subsidies in agriculture, prioritize financing. We have to prioritize कि भाई ज़्यादा फाइनेंस करें, कैपेसिटी डेवलपमेंट, इनोवेशन. Prioritize financing, innovation, capacity development, multi-sector. One health response to AMR will not only help reduce the risk and burden of the AMR society, but will also help address the triple preventive classes, fungal disease and plan. According to a study developed in the General Nature, global crop growers have experienced a 10 to 23% loss in crop due to the fungal disease. The 5 most important crop: rice, wheat, maize, soybean, and potato. Maize, potato लेके आया, soybean and potato are vulnerable to fungal disease such as rice blast fungus, wheat. राइस में ब्लास्ट फंगस, वीट में स्टम रेस्ट है, कॉर्न में स्मट है, सोयाबीन में रस्ट है, स्मट है, कोयमिना है, पोटैटो में लेट ब्लाइट है. अबाउट फंगल डिसीज इन प्लांट, फंजाई कैन बी सिंगल सेल मल्टीसेलुलर ऑर्गेनिज्म. फंजाई कॉज द ग्रेट मेजॉरिटी एस्टिमेट 2,000 infectious plant disease. They include all white and true rust, smut, needle cast, leaf curl, mildew, smoothie mold, and anthracnose. So source of fungal infection are infected seed, soil infected है, crop debris, nearby crops and weeds. Fungi is spread by wind and water splash and through the movement of the contaminated soil. Animal workers, machinery, tools, seeding and the plant material enter the plant through the natural openings as stomata and through wounds as caused by pruning, harvesting, hails, insect, other disease, mechanical damage. Considered with fungal infections, devastating impact of fungal disease will worsen due to the climate change. The rising temperature are causing fungal infection to move steadily towards the poles about 7 kilometers high. Here, for example, wheat stem rust infections usually reported in tropical countries have been found in England and Ireland. Higher temperature increase the development of new fungal pathogens. Various and practicing monoculture has enabled the fungus to quickly evolve and develop resistance to the fungicide. Practicing monoculture. अगर आप मोनोकल्चर कर रहे हो, enable the fungus to quickly evolve and develop resistance to the fungicide. The spike and the use of the antifungals in agriculture leading to more fungicide resistant pathogens. The fungal disease in crop threaten the food security. Non-communicable disease and Ministry of Health and Family Welfare is the strategic operational guideline for the National Program for Prevention and Control of the National Program for the Prevention as well as Control of Non-Communicable Disease 2023 से for the management of the non-communicable disease. Other initiative launched during the event 75-25 initiative launched 25 million people with hypertension and diabetes to be put on standard care by 2025-25 through public health centers. It is the largest cover of non-communicable disease in the world for primary healthcare success. Portal was launched for training 40,000 primary health PHC, primary healthcare medical officers on standard treatment workflow for non-communicable disease initially to realize the healthcare service closer to the community. Guidelines were released on the occasion of the World Hypertension Day as a part of the G20 Covenant event focused on primary and the secondary prevention, secondary prevention, clinical support for NCD, the existing National Program for Prevention and the Control of the Diabetes, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, National Program for Prevention of Cancer, Diabetes, Cardiovascular Disease and Stroke primarily has been renamed National Program for Prevention and Control of the Non-Communicable Disease. Also widening in the ambit of the program, including the chronic obstructive pulmonary disease, asthma, non-alcoholic fatty liver disease, a Pradhan Mantri National Dialysis Program, etc. Comprehensive Primary Healthcare Non-Communicable Disease IT Portal, National Non-Communicable Disease Portal enables the population enumeration, risk assessment and screening, for 5 common non-communicable disease. About non-communicable disease, also known as chronic disease, tend to be the long duration as the result of the combination of the genetic genes का भी होता है, physiological, environmental and behavior factors. NCD are not transmitted from person to person. Enable the population enumeration, risk assessment and screening. Non-communicable disease, there are 4 main types of the type: cardiovascular disease, cancer हो गया, chronic respiratory disease and diabetes, hypertension, obesity, metabolic syndrome, rheumatoid arthritis, cerebrovascular disease, degenerative disc disease, carpal and faculty depression, cognitive impairment, neurogenetic genetic disease. What are the factor behind the NCD? Behavioral risk factor. आपकी डाइट अच्छी नहीं है, जंक फूड, lack of physical activity due to sedentary lifestyle, use of tobacco causes most lung cancer, alcohol consumption causes high blood pressure and heart disease, physiological disorder, blood pressure because of low exercise, is a cholesterol due to the smoking and unhealthy diet. Obesity occurs due to the high calorie food, blood glucose due to the stressful life and less sleep. Impact of the non-communicable disease. NCD are the largest cause for mortality in the world. Rise in percentage of the poor population. Economic loss estimated on 47 trillion due to the 47 trillion due to non-communicable disease by 2030. Huge out-of-pocket cost to families due to the healthcare service inequalities for the non-communicable disease treatment, decrease the labor force availability and their productivity. Lack of trained human resource. As per the Ministry of Health and Family Welfare, country had only one doctor for every 1457 people. Although WHO recommends a doctor-patient ratio of 1/1000. 1000. Low budget allocation and budget. For example, the Union Budget 2023 health funding for the non-communicable disease control program to ₹29 crore. पहले 500 करोड़ था, 289 crore हो गया. Poor implementation plan, such as the lack of comprehensive information pool. Information नहीं है, management अब information नहीं है, अगर है भी तो उस management information system नहीं frequently monitor the reach and implementation progress of the national non-communicable disease program. 66% and total death due to non-communicable. अगर इंडिया में डेथ हुई तो 60% non-communicable disease हुई है, 71% of death globally, 25.6 lakh death due to cardiovascular, 25 लाख death जो हुई है वो cardiovascular disease की, 11.4 lakh due to the chronic respiratory disease. Poor adherence to the medication. For example, 1 in 2 patients do not take their treatment as directed, and 1/3 of the patients who take medication stop their treatment either than directed. Difference between the communicable and non-communicable communicable highly infectious pathogens and carriers spread the disease include causes include allergy, mild regional illness brought on by the internal changes in the lifestyle and surrounding abnormal cell growth, etc. Virus, bacteria, etc. Cannot be passed from one generation to another. Can be inherited through generation, develop immediately, and is acute, develops over a period and last longer. Anticipated traditional methods may work simply, surgically specialized treatment, tuberculosis, malaria, etc. Alzheimer's disease, hypertension, asthma. Okay, changing lifestyle due to the sedentary lifestyle in an urban area. It is driven by unchallenged aggressive marketing strategies of unhealthy food and beverages and alcohol industry. Initiative taken by the India to curb the non-communicable national program for prevention and control of the cancer हो गया, diabetes हो गया, cardiovascular disease and stroke program. NPC DCS. It was launched in 2000. The Ministry of Health and Family was launched under the National Health Mission. Program is implemented to address the common non-communicable diseases like cardiovascular disease, hypertension. National Action Plan by Ministry of Health and the Family Welfare, which was launched in response to the WHO Global Action Plan for Prevention and the Control of Non-Communicable Disease 2013 से 2000. WHO Global Action Plan for Prevention and Control of Non-Communicable Disease 2013 से 2020 aim to reducing the number of the global premature death from the non-communicable disease. ठीक है, अगर कोई non-communicable disease से जो premature death हो रही है 25% से कम करना है by 2025 25 by 25. Global Initiative for the Non-Communicable Global Coordination Mechanism for Non-Communicable WHO plays an important role in promoting action between the government, civil society organization and other players working to improve the health by preventing and controlling non-communicable disease. Data portal aims to raise awareness on progress in tackling the non-communicable disease and their risk factors and strengthen the accountability for action by the countries. Preventive strategies. The aspect of non-communicable strengthen the comprehensive primary healthcare through Ayushman Bharat Health and Wellness Center scheme by promotion of the wellness activities and targeted communication at the community level. Healthy diet. It is also promoted to the Food Safety and Standards Authority of India through the Eat Right India movement, and which will help develop healthy dietary plan and hence reduce the chance of non-communicable physical activity India movement. Eat Right India movement, Fit India Management, Ministry of Youth Affairs and Sport for improving the physical activity. Outcome-based budget. I think government has for the time reduced hypertension and diabetes treatment as output indicator reflecting the government's commitment to scale up hypertension and diabetes coverage services. Second suggestion, moving forward for non-communicable multi-stakeholder approaches. For example, civil society can help increase awareness and educate the public on healthy lifestyle. Civil society can help increase the awareness and educate the public on healthy lifestyle. Awareness, educate, improve access to quality healthcare, including affordable medication, essential medical service can help manage and treat the entities. Healthcare कहना चाहिए quality healthcare, affordable medicine, essential medical service. Engaging communities in the prevention and management of non-communicable can be effective in raising the awareness and promoting healthy behavior. Implementing policies and regulations that limit exposure to risk factors for obesity, including the tobacco and alcohol use, can be effective in preventing these diseases. For example, increasing the taxes on tobacco and alcohol product. Private sector participation collaboration of the public and the private sector to address the growing potential of non-communicable disease. The private sector can also play a remarkable role in promoting the healthy products and the service of private organizations. Collaboration countries in the Southeast Asia need to create a new and effective regional roadmap to accelerate non-communicable disease control. Focus should be on prevention. Greater efforts to be put into prevention, which includes lifestyle change through eating good food, exercising, and other wellness practice.